So this is part 2 of the My EDS tag, or this is my EDS tag, which is being filmed directly after the first part, what will likely be uploaded later, which is why I'm in the same spot and wearing the same cat nightgown. My cat seems to have calmed down though, so she shouldn't bother as much this video. So just moving right into the second part, which is about diagnosis, which I can talk about really easily because I was actually diagnosed only back in December, as I've mentioned, I think a couple of times. So question 1, how long did self-diagnosis take? When and how were you ultimately diagnosed? I'm not going to answer this question in tandem, I think, with the third question, which is when did you first start experiencing symptoms? When did you acknowledge them as symptoms? Because I've had health problems, or not, I don't want to call them health problems because I don't get sick particularly often. I don't often have colds. I don't often have a fever or anything like that, but I have like physical issues. I've had physical issues pretty much my entire life. Like as a little kid, there was this whole situation where like I walked with one of my feet turned in. We went to a doctor and he told me that I had weak hips and that I should never, like, he called it sitting like a frog, or like W sitting, which is I guess when you like sit with your knees turned in but your ankles turned out like that. He told me I should never sit like that because it would be really bad for my hips. And I like sprained an ankle really badly in like second grade, just like getting off of a swing. It just like collapsed from out from under me, stuff like that. And just little things that would happen and never be resolved. But it didn't really start occurring to me. It was like a systemic issue, or like that these things could be related, until probably about a year and a half ago when I first sort of started hearing about people with EDS. It was when I first started getting really more involved with like thinking about my physical state and like looking at like spoonie blogs on Tumblr and stuff, was I think the first time I'd ever actually heard of Ehlers Danlos syndrome. And I started looking into it and realizing that like all of these like annoying disparate things that were wrong with me, like my stomach problems and my joint pain and how often I sprain my ankles and stuff like that, could be related instead of just like weird random shit that was wrong with me. So the process of diagnosis and self-diagnosis probably took about a year and a half, but I had been experiencing symptoms and just not realized they were one problem for quite a while. But probably towards the end of high school when I dislocated my knee, or middle of high school when I dislocated my knee and it just didn't want to get better, is when I realized like, okay, something is really wrong here. Because basically what happened with my knee is in 10th grade, I was standing in a kitchen at a friend's birthday party and my knee just completely popped out of the socket, apropos of nothing. Like I was just standing still in her kitchen and I collapsed on the floor, and it was this whole thing. It was really bad. It swelled up to the size of one of those like really big grapefruits, you know, like the pomelo ones that look like basketballs. Yeah, it was bad. And I ended up having to have surgery on it, and I also had this like recurring problem with my ankle, and just no one could ever tell me what was wrong with it, and like a bunch of little stuff like that. And then I started looking into EDS probably about a year and a half ago, and I was like, oh, these symptoms could be connected. They could just not be like disparate things. They could all be this one thing. And so I did a lot of research, and then I ended up talking to my primary care physician when I was home for Christmas, and she miraculously, like literally possibly an actual miracle, because so few doctors are familiar with Ehlers Danlos, has other patients with Ehlers Danlos. And she said, she's like, you know, I'm not sure if you do, you probably have like a more mild form of it or whatever, but you know, she was willing to listen to me enough that she referred me to a geneticist. And I got the referral like a couple of days later, and I got in contact with them over the phone, and they set up an appointment for me before I went back up to Oregon. And I talked to the geneticist, and I told him like what we knew of our family medical history, which is not a lot. My grandmother was in foster care, and my father is dead, and we don't talk to his side of the family, so it's pretty much just like whatever minimal knowledge my mom and I have about my grandma and the rest of her relatives, which is not a lot. But so we gave him that, and we told him like my medical history, and he, you know, bent some of my fingers, and he actually didn't even bother looking at my legs because I just had so much like information about what a train wreck my lower body is. And he, by the end of the appointment, he said, yeah, I think you're right. I think you have this. And he diagnosed me with it. So I was diagnosed in late December. So yeah, that was that. So it was like, sorry, someone just sent an email to my phone about thesis, and I got distracted by the little pop-up. But yeah, so I knew something was wrong for like quite a while before I started realizing all of the wrong things could be the same wrong thing, which I think is probably a lot of people's like Ehlers Danlos story. Was my emotional reaction when I was diagnosed or self-diagnosed, and now when I first self-diagnosed, I was really nervous about seeking an actual diagnosis because I am a fat person, to be honest, and it's always kind of daunting trying to get people to listen to you about like joint issues and pain issues when you are overweight, because they just want to blame everything on your weight and not consider that like difficulty exercising or like getting outside and moving without being in a lot of pain could be contributing to the fact that you are overweight. I haven't been allowed to do any impact-based exercise since the 7th grade. So I was really nervous, but when I did talk to my doctor about it, and then my doctor referred me to the geneticist, and the geneticist was honestly like really great. Like he didn't bring up my weight at all until like the very end of the appointment, and he was like really understanding about how like those two things interact and how it can make things difficult. And I was mostly just relieved. It's just the same way I felt with a lot of my diagnoses, like when I was finally diagnosed with like depression and anxiety back when I lived in Southern California. I was just like, oh, thank God somebody knows what the fuck is wrong with me, because God knows I don't. Yeah, so mostly just like relief after just like wondering for so long, like what is happening with this everything. So yeah, relief, definitely. Number 4 is, was there a specific age where my health drastically changed? If so, when was that? I think it probably happened like a couple of times, if that makes sense. Like, I've had, mostly due to like a couple of injuries I had, like when I re-injured my ankle in 7th grade, and then when I injured my knee in 10th grade. They prevented me from doing a lot of things that I would have done previously, and I think that sort of had a degenerative effect on my health in general. And then when I went away to college, my mental health, for various personal reasons, just took a complete freaking nosedive, and that had a lot of like physical consequences, and I wasn't taking very good care of myself. Yeah, and then I've just noticed, I think, like, as I get older and as I'm moving more, I mean, not that I'm old, I'm going to be 24 in, like, a couple weeks, but just, like, as I, use my body more and move through life, I just have noticed sort of, I guess, like, slowly increasing general pain in the past. Hi, cat. My cat just laid down on my foot. The past few years. But yeah, I would say like 7th grade and 10th grade, and then probably about my 2nd year of college. And then it's just been kind of a roller coaster between my 2nd year of college and now. I've had a lot of stuff happen. I passed out in my shower. I had to go to the ER because I was in a lot of pain. I had my gallbladder removed. I had a flare-up of this really unpleasant skin infection called erythema nodosum last semester, not next semester, that like really screwed my legs up and made it really hard for me to walk, and I missed a lot of classes, stuff like that. So the past like 2 or so years have just been kind of all over the place health-wise, honestly. Yeah. Okay, so number 5, what medicines, treatments, and or devices do you typically need? Do you have access to all of your needs? This is a difficult question for me because I'm not really sure. I need a knee brace, but the problem is I can't find an affordable knee brace that'll fit around my giant thighs, without being uncomfortable other places. So sometimes I just go with like self-adhesive ace bandage, on my knee. I am usually wearing 1 or 2 ankle braces. I also have insoles for my shoes because I have high arches. And so like the high arches and the combination with my, my weak ankle muscles and my feet just kind of like, it's bad. So I have those. I have very, very limited access to painkillers. I'm trying to work out something other than that, or something that works. It's difficult, for people with chronic pain right now, and like the hostile environment of like the medical industry towards like painkillers. I take a lot of Advil, which is not great for your stomach, unfortunately. I've been thinking that for bad days recently, I should be investing in a cane or some crutches or something, but I just don't. I don't know what, and I should also probably be in physical therapy, but again, finances and getting to and from places, I don't drive for various reasons. And I live in a city, and it's pretty easy to get around, but, just because I can really easily get to school and really easily get to, the grocery store doesn't mean it's as easy to get to like a major medical campus, cheaply and easily. It's one of them is only like a 10-minute train ride, but the other one is like a 45-minute train ride, or, $40 both ways and a lift, stuff like that. So yeah, that's kind of an in progress thing right now. I'm not really sure. 6, how often do you go to the hospital, and how comfortable are you in medical environments? As I said, I don't really need to go to the doctor that often. I think I said that in my previous video, that I should probably go more than I do, and I just don't. And part of that is I am not at all comfortable in medical environments. Just a little backstory for context. When I was 15 months old, I was diagnosed with retinoblastoma, which is a cancerous tumor of the retina. And so as a kid, I spent a lot of time in the hospital, and I spent a lot of time at the doctor's office. I think I had checkups like every 2 weeks, and then every 4 weeks, and then every 6 weeks, and then every 2 months, and then every 6 months. And about sometime in middle school, I think, we got up to once a year, and now I just have eye checkups once a year. They used to be under anesthesia and a lot more invasive, and now they're just like basic eye exam. Well, not basic eye exams, they're a little more involved, but now they're just eye exams, and I stay awake for them. But so between that and like difficulty with my joints as a kid, and also like family health problems, my grandmother has a lot of issues, so we spent a lot of time in the hospital with her. I just really don't do well in hospitals. They make me really, really anxious. I mean, the last time I went to my my primary care physician, and to be fair, I was off of my depression meds and taking a lot of prednisone because of some swelling I was having because my erythema nodosum, but I basically had like a sobbing emotional breakdown in her office because I'm so on edge with doctors. Doctors' offices make me really anxious. I try and usually bring either my partner or my mom, because I have a tendency to go nonverbal in medical environments and not be able to explain what I need or what is wrong. And I usually bring like a stuffed animal or like my hospital doll from when I was in treatment when I was a baby. So I don't go that often. I should probably go more, but I don't because of money and time, and also I hate hospitals and doctors and medical offices and the dentist. God, I hate the dentist. 7. Oh, that's another EDS symptom I have. I should have mentioned in the last video. I have terrible teeth. 7, what kind of resources and support do you use? I do a lot of like personal research and a lot of trial and error. I mean, my braces are from Rite Aid. They're Ace braces. They're Velcro and neoprene. I take a lot of hot baths. I know that that's not like the best thing for like, because it makes your muscles loose, which can cause further injury, but sometimes the pain relief is more important, and the like physical relaxation that can give me. I take vitamin supplements. I don't know if they do anything, but I'm sure trying, stuff like that. I'm hoping to get into physical therapy sometime in the next year, probably not until I'm done with school. I only have 1 semester left, and it's going to be really busy because I'll be working on my thesis project, which is a book. But I'm hoping to like get into physical therapy, hopefully a physical therapist who is either willing to learn or is already familiar with, if not EDS, at least joint hypermobility, so they know what I need to do not to injure myself. And I'm also hoping to maybe start going to a gym so I can use like weightlifting machines and get back into a pool. I used to swim, and those are some things that I like talked about with my geneticist, like safe ways for me to like exercise and keep my muscle strength up without endangering my joints and stuff. So yeah, just research and trial and error and complaining to my friends on the internet. And my mom doesn't have EDS to our knowledge, but she does have a lot of like chronic pain issues and like general like physical problems, so she gets it. So yeah, that's, my friends, trial and error, the internet, hopefully doctors, but I don't really have the time or resources for that right now. I'm hoping I will be able to take more advantage of that soon if the government doesn't take away my health insurance. Cross your fingers. So that's part 2, and part 3 will be up soon. Thanks, guys.